Hello everybody, my name is Urs Brodbeck and I'm a private practitioner in Switzerland. I have a special passion for reconstructive dentistry and implantology. When I started with implantology more than 30 years ago, we did not see many infections around implants, but after a while we all realized around teeth we have a thing called periodontitis and the same around implants, peri-implantitis. What can I do to heal that implant that I can maintain it for a longer time? So we saw that problem, and then what shall we do? A dental hygienist, of course, she can help, but one day we doctors, we have to make an intervention. So we raise a flap, we look on the surface, and then what do we see? Of course, we see crater in the bone, we see bone loss, but there is always a biofilm on the implant. So the cause for peri-implantitis is a biofilm. Same cause we see in periodontitis. A dental hygienist can do scaling and root planning, and then the biofilm is gone. But what can I do around implants? The implant companies, they produce a rough surface with a micro texture on the surface. That's not so easy to clean as a natural tooth. We tried a lot of things how to remove the biofilm. We used lasers, we used powder, water sprays, we used toxic agent, we rinsed with peroxide, whatever, but none of these things could help really to remove the biofilm completely. So about 10 years ago, together with two friends, Holger Zipprich and Markus Schlee, we said we have to solve the problem, and then we founded the company of Galvosurge. So Galvosurge is an electrochemical cleaning of the implant surface. We can clean an implant in the oral cavity completely from the biofilm. And we even had studies that after cleaning with Galvosurge, the bone can grow again on the implant. We can call this osseo-integration. We published these data, and many colleagues nowadays are so happy that they have a device how to remove the biofilm completely from the implant surface. The main difference between all the other things I mentioned at the beginning is that with the electrochemical cleaning, we clean the implant inside out. That's completely different because, for example, with sandblasting, we come from the outside to the inside. So what are we doing actually with Galvosurge? We produce hydrogen with the electrolysis directly on the implant surface. So we create bubbles between biofilm and titanium surface. Little bubbles, they grow to bigger bubbles, and at one moment the biofilm will disappear from the surface. The biofilm is pushed away, and what remains? A meticulously cleaned surface. It's absolutely clean from any organic structure, and the body accepts it in the same way as if you would have a new implant from your implant provider. So you do not see a difference on the surface after hydrolytic cleaning than if you get it from your implant company. The first cases we did is about 8 years ago. So it's not a brand new, but it's on the market since about 2 years. And just recently, Straumann, that's one of the leaders worldwide, has bought the company. And together with Straumann, we distribute now these products worldwide in the dental market. So if you see next time one of these x-rays we all do not want to see, you see one of your implants and suddenly half of the bone is gone, Galvosurge might be an opportunity, might be a possibility to save that implant because you can clean the surface. What do you do afterwards? If you do GBR, if you just do whatever, that's up to you. But if you think about cleaning, nowadays I think the scientific data are really showing to the direction Galvosurge is the best method to take all the biofilm from the implant surface. Of course, it's a new product. Many questions will arise. Feel free to contact me. It's still my baby. Also, it's now in other hands. Contact me. It would be fun for me to interact with you and to help not only my patients, also to help your patients.